Welcome everyone to Silver Tsunami, Medicare Basics for an Aging Workforce. Thank you all so much for joining us. Our moderator for today's call is Beth Allen. She will be answering the questions you send through the Q&A today. We will try our best to answer all of your questions, but if for whatever reason we are unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We will be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you will receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At this time, I'd like to introduce our speakers for today's call. Joining us today are Kelly Ekman, Vice President of Benefits Compliance at NFP, and Yoko Yoon, Assistant Vice President of Benefits Compliance at NFP. Kelly, the floor is yours.
All right. Thank you, Amber. And thank you everyone for joining us today for Silver Tsunami, Medicare Basics for an Aging Workforce. Before we get into anything, we always want to remind people that today's presentation is intended for general guidance purposes only. So we're not providing tax advice or legal advice. So any questions about the law should be addressed to your legal or tax counsel. And the information that we are giving is current as of today, August 16th. All right, you can see our smiling faces. Again, I am Kelly Ekman and Yoko Yoon is joining me today to talk about Medicare. So what we're going to cover today, we're going to go through just a quick overview of Medicare itself and what eligibility and enrollment looks like. We're going to talk through some of the impacts of Medicare for employers, so things like Medicare secondary payer laws. We're going to talk about how Medicare interacts with other things like HSAs, qualifying events, COBRA, and then look at some reporting and disclosure rules as well. Go ahead and go to the next one for me, please. Thank you. So again, we're going to start with Medicare Basics. And so just to really start us off, we're looking at, the two government agencies that are really tasked with the application of Medicare. So we have CMS, so the Centers for Medicare and Medicaid Services. They're the ones that are managing Medicare and then obviously Medicaid as well. And then we have Social Security. So Social Security works hand in hand with CMS to enroll people in Medicare coverage. Okay, so we're going to do just kind of a brief overview of exactly what Medicare is, because I think it's important for employers to understand kind of the different parts that make up Medicare and how it may impact your employees. So the first one we start with is Part A. So this is part of Original Medicare. So Part A provides hospital insurance. So that's your inpatient hospital care, your skilled nursing, and then hospice and home health care. Now, most people aren't going to pay a premium for Part A, so sometimes you'll hear this referred to as the free part. Part B is the next one. So Part B is often the bulk of care that someone might receive under Medicare. So this is really the medical insurance part. So this is going to be your doctor and physician visits, outpatient care, preventive care and screenings, maybe physical therapy, occupational therapy, that kind of thing. Now, individuals do pay a premium for Part B. So the standard premium in 2023 is $164.90 per month. Now, high income earners may actually pay an additional surcharge on top of this base premium. So the standard is the $164. Some folks may actually pay a higher amount each month. Okay, Part C. Part C, we don't hear it called Part C too often. You typically hear it called Medicare Advantage. So Medicare Advantage plans, they're going to combine the same coverages that you see over in Parts A and Part B. It's just handled a little differently. So instead of being run just through the government, you can think of it as the government is outsourcing Parts A and B to an insurance carrier. But it's still going to be the same coverage types that you're going to get under Parts A and B. Medicare Advantage plans often include prescription drug coverage, but some do not. And so if they don't, then participants may need to also buy a Part D plan that we'll talk about in just a minute. And the Medicare Advantage plans, one of the reasons they can be quite popular is that they often include additional services like dental and vision coverage. Sometimes they have gym memberships, wellness programs, that kind of thing. Medicare Advantage plans, again, you're going to pay a monthly premium on top of that Part B premium we talked about already, but it's going to vary by the type of plan. And sometimes the monthly premiums can be as low as $0. So sometimes those who are maybe lower income may find Medicare Advantage plans to work best for their financial needs. And then the fourth part here is Part D. So we think of this as D for drugs. So a Part D plan is a standalone drug plan. Again, commonly it's going to pair with original Medicare, so that those parts A and B, but again, sometimes it may pair with a Medicare Advantage plan. And now the premiums an individual is going to pay, it's going to vary based on the actual drugs that they take. And once again, just like with Part B, high income earners are going to pay an additional surcharge on top of that monthly premium that they pay for their Part D plan. Okay, we'll go to the next. Thank you. So now we're going to look at Medicare eligibility and kind of what enrollment looks like. So the important thing for employers to remember here is, if someone's asking you a question, is that enrollment in Medicare is not always automatic. So just because someone turns 65, it doesn't mean Medicare is automatically going to begin. Now, for some people, it will be automatic. So if someone's already receiving Social Security or railroad retirement benefits, once they turn 65, their Medicare is going to be automatic. But if you're not already receiving those benefits before 65, you're going to have to separately apply for Medicare Parts A and B. Go to the next one, please. Thank you. And then a couple other situations where people might have automatic enrollment or eligibility into Medicare. So again, we talked about prior to 65 and receiving Social Security or railroad retirement. You can also get Medicare if you are under 65 and you are receiving Social Security disability. Some individuals with ALS or end-stage renal disease, those are two other ways that someone may get Medicare enrollment prior to age 65. Okay, so we're going to talk about 3 different periods in which someone might be able to enroll in Medicare. And we'll talk about each of these in a little more detail. But those 3 are going to be your initial enrollment period. So think of that as the time when someone has first turned 65. And then we have a special enrollment period. So that's a time when someone, they didn't enroll during the initial enrollment period, they may have an opportunity to enroll in a time period as long as it's been more than 3 months after they turned 65 and they meet some other criteria we'll talk about. And then the third way that someone could enroll in Medicare is if neither 1 or 2 above fits, they would have to wait until Medicare's general enrollment period. And that would then be the time they can enroll. Next, okay, thank you. So we're going to look at the initial enrollment period first. So the initial enrollment period, it's a 7-month period surrounding the time someone turns 65. So you have the 3 months prior to turning 65, the month in which you turn 65, and the 3 months after. Those are the 7 months that encompass the initial enrollment period. Okay, and one thing to note is that, even if someone enrolls in Medicare those 3 months prior to turning 65, their coverage wouldn't begin until they're actually 65. But it just lets someone who likes to get their ducks in a row get that enrollment ahead of time. Now, individuals could possibly face a late enrollment penalty if they don't enroll during this initial enrollment period, unless they qualify for a special enrollment period, which we'll talk about in just a little bit. Go ahead. Thank you. So the Medicare special enrollment period. So let's say the initial enrollment period is passed and someone has chosen to delay enrollment into Medicare because they are continuing to work. So if you work for an employer, or again, you are the employer, and you employ 20 or more employees, and the employee is actively working and enrolled in your coverage, they can choose to delay enrollment in Medicare without a penalty, as long as they were covered under the group health plan as an active employee. Okay, and it's important to note here, we have here in bold, COBRA coverage is not active coverage to delay that Part B enrollment penalty. Similarly, retiree coverage is not active coverage. So we're really just thinking about somebody who is still actively working for your organization. Now, once active employment ends, that's when this special enrollment period begins. Technically, someone has 8 months to enroll in Medicare Part B without incurring that late enrollment penalty. However, we kind of have to stop and think about it. If someone wants to purchase a Part D plan, a Medicare supplement, or a Medicare Advantage plan, they typically have to purchase those within 63 days of that active employee coverage ending. So even though we think of the special enrollment period as lasting 8 months, typically individuals may make a choice and enroll prior to, or within that 63-day window. Coverage following a special enrollment period begins on the first day of the month following that enrollment. And obviously, for our employers on the call today, we're always going to want to encourage employees to be working with a licensed Medicare agent. So we don't expect you to be trying to answer these questions for them, but just kind of the basic understanding of, how that special enrollment period works for someone who has chosen to delay Medicare enrollment past 65 because they are still working for you. And then the third way someone might enroll in Medicare, so they didn't enroll during their initial enrollment period. They didn't have a special enrollment period available. So they're going to enroll in Medicare's general enrollment period. So this runs January 1st through March 31st of each year. So again, it's for those who didn't enroll in those periods I mentioned. So coverage begins on the first day of the month following that enrollment. And this was really interesting because prior to January 1st of this year, if someone enrolled during the Medicare general enrollment period, their coverage didn't begin until July 1st. So even if they enrolled in January, they're going to have to wait 6 more months for that coverage to start. So this was really a welcome change, I think, for folks who hadn't enrolled earlier when they should, and then were joining during that general enrollment period. Okay, and then just a real quick note on kind of 2 other aspects of Medicare. So again, Part D, D is in drugs. Again, I mentioned earlier, Part D plans are going to vary based on the prescription drugs that are covered under the plan. What's interesting with Part D is that individuals can actually change plans each year during Medicare open enrollment. So that's why the Part D creditable coverage notices that, you guys send out and Yoko is going to talk about in a little bit. That's why these are so important, because individuals do have the option to change their Part D plan each year. Now, you may have heard of a Part D late enrollment penalty. So if someone goes 63 days or more without creditable drug coverage, they may incur a penalty. Now, what's interesting is the penalty is 1% of the national base premium, and it's going to be times the number of months that someone doesn't have credible drug coverage. So looking at 2023, the premium is $32.74. So if someone goes 1 month without credible drug coverage, their penalty is 32 cents. Okay, so if we think about that, if someone didn't have creditable drug coverage, let's say for a year, and they should have, their penalty would be about $4. Now they would pay that $4 every month for the rest of their life. So it definitely can add up, but I think it's nice to kind of put some numbers to what exactly that Part D penalty looks like. And again, I mentioned earlier, high income earners do pay a surcharge on top of that Part D premium that they are paying. And then finally, Medicare supplement plans. So these used to be more commonly known as Medigap policies. Now we really hear Medicare supplement as kind of the more common phrase. But this is supplemental coverage. It's going to help cover out-of-pocket costs that are not covered under Medicare Parts A and B. So some of these are things like the Part B annual deductible, the Part A deductible, foreign travel emergency costs, that kind of thing. Plans are lettered, so A through N. And what's interesting is the plans are standard regardless of carrier. So that means if I buy a plan N through Humana, it's going to cover the exact same things as a plan N through United Healthcare. And then for individuals who do want to get a supplement, they're going to want to purchase that either during the IEP or the special enrollment period to avoid underwriting. So they get a guaranteed issue right to enroll in those when they are first eligible, and then they would be underwritten after that. And so I think that's my last one, just on some Medicare basics. And now Yoko is going to talk us through one of the first employer impacts with Medicare secondary payer laws.
Great, thank you, Kelly. So switching the gear and start talking about more applicable to the employers when you think about the plan design. So you may have heard Medicare secondary payer, but we're going to go over such as coordination of benefits, what is considered taking into account when some of your employees or spouses are Medicare entitled, meaning enrolled, or seeing benefits need to be applied for those employees who are age 65 and below. So you cannot segregate those employees who are eligible for Medicare, for example. And we're going to go over who pays first, Medicare versus the active group health plan. Okay. So Medicare secondary payer MSP rules. So basically states that it prohibits employers from offering financial incentives to Medicare eligible enrolled employees to waive or cancel your coverage. So some employers may think that in order to, especially if you're sponsoring self-insured plans, in order to minimize cost, you may think about potentially like eliminating coverage for the Medicare eligible employees. However, that is not most of the cases. It's not allowed unless your group is very, very small, that we're going to go over as an exception, but most of the cases not allowed. And some other ones are same benefits need to be offered for any eligible employees, regardless of if the employee is eligible for Medicare or not. So here are the applicability of MSP rules. So it depends on it's not a one size fit all. Unfortunately, it's a bit more complicated and depends on the situation too. The first one is the most common one that we often encounter, which is the age based, so meaning that those employees or spouses who are age 65 or above, so because of the age that they are eligible for Medicare. And in that case, group health plans of employers with 20 or more full-time and part-time employees for each working day in at least 20 weeks, either this year or last year, will be applicable to the MSP rules. So in that case, we're going to look at it, but basically the group health plan will pay first and Medicare will pay second. And then for the second one that Kelly talked about, if you have an employee who is under 65 but are eligible enroll in Medicare because of the disability reason, then employers with 100 or more employees, regardless of full-time or part-time, and on at least 50% of the business days during the previous calendar year, will be subject to the MSP rules, meaning those employers with 100 or more, group health plan will pay first and Medicare will pay second. The last one that we are going to look at is the ESRD. Which is applied to all employer group size under the general MSP coordination benefits rule. So regardless of the group size, Medicare group health plan pays for the first 30 months, and then Medicare will pay second after 30 months. So the next slide might be helpful to understand. This is the kind of recap of what I just went through. So depending on the types of coverage that you have and the types of the Medicare reason, so this is a chart of who pays first. So the retiree coverage that I did not go over, some employers sponsor retiree coverage, and depending on the term, some retiree coverage kind of ends when an individual becomes eligible for Medicare. And if that's the case, it may not be applied so much, but some other retiree coverage that cover longer than Medicare, regardless of the Medicare entitlement, even if the employer sponsors retiree coverage, usually Medicare pays first and group health plan pays second. And for the working age, so those individuals, employees who are 65 or above, and an employer has a 20 or more employees, then group health plan will pay first and Medicare will pay second. And if it's a disability reasons, and then the Medicare entitlement, just a side note, Medicare entitlement for the disability begins after Social Security disability benefits have been paid for 24 months. So, and just to give you some idea when that Medicare will kick in, when an employee is eligible for Social Security disability benefits, so usually 24 months, unless beneficiary suffers from the ALS. In that case, it will start from the same month. So if that case, the group health plan pays first for those employer with 100 plus, and Medicare pays secondary. But if your group plan is under 100, then Medicare will pay first. And for the last one is the end stage renal disease, ESRD. If that reason is ESRD, the group health plan, regardless of the group size, group health plan will pay first for the first 30 months, and Medicare will pay secondary after 30 months. Yeah, and then Kelly will go over in detail about the COBRA. But COBRA case, usually Medicare pay first and group health plan, which is basically the COBRA will pay second. And a couple of the practical application that may be helpful to illustrate what we've been talking about. So first example is that ABC company has 75 employees, and as a cost saving measure, it decides to exclude all employees aged 65 and above from their group health plan eligibility since they are eligible for Medicare. Is this permissible? And the answer is no, because employees and spouses aged 65 and older must be eligible for the group health plan under the same terms and conditions as other employees. The second example is that another company has 47 employees. So 47 employees, they have several employees who have waived group coverage to go on Medicare. It was a cheaper option for the employees and it saved the employer money. So the company wants to help these employees pay for Medicare coverage. It seems fair since the employer contributes to the cost of coverage for other employees. Is this permissible? The answer is not, because the company has more than 20 employees, and because an employer cannot encourage or incentivize a Medicare eligible employee or spouse to drop group coverage, and contribution can be viewed as an incentive. Hope some of the concrete example help you illustrate what the MSP rules are. And a couple of the red flags, if you're thinking of these plan designs that will interfere with the MSP rules. One is we already went over, excluding entirely employees or spouses for age 65 and above from group health plan. I haven't seen it yet, so hopefully that's something that you're not thinking of. Or offering one plan to employee below and a different plan for the age group 65 and above, or paying or reimbursing Medicare supplemental premiums. It can be possible if the group is not subject to the MSP rules, such as the group size below 20, but majority of the group health plan need to be cautiously taken care of, need to be cautiously tread carefully about paying for the Medicare supplemental premiums, and also think about the HR and how it will be funded, even if a group is small. And then another one is employees different premium contribution based on Medicare enrollment or eligibility. So next one is permissible practices are exclude coverage for all spouses. As you know, the employer mandate also, even if you are subject to employer mandate, offering coverage to spouses are not required. So that might be a possibility, even though we have not seen many groups do that. And second, permissible practice is offer any eligible employees, not just the Medicare eligible employees, a cash amount, also called cash in lieu or opt out. So as long as that incentive of either taking your group health plan versus another plan, spouse plan, for example, is apply, that incentives apply for all eligible employees, is usually permissible practices. And third one is offering a Medicare supplement plan to retirees. The next slide. So we talk about the importance of really considering, like, not segregating or like discriminating against those age group 65 and above by charging more premium, for example. And if you fail to comply with MSP and then your group size is large enough that you need to comply with MSP, the exercise penalty can be 25% of group health plan expenses. And in addition, could be 5,000 per incident. So as you can see, like, the penalty amount can be significant. So it's important to understand which Medicare type that you have to, your primary payer, and also what are the things that you are not allowed to do in terms of the plan design and contribution structure. Okay, hand it back to Kelly.
All right, thanks, Yoko. So now we're going to look at, again, just kind of how Medicare works with a couple other benefits items and benefits laws here. Okay, so the first one we're going to talk about, something we get questions about quite a lot, are Medicare and HSAs. And so just as a refresher, we know if somebody is enrolled in a qualified high deductible plan, they may be eligible for an HSA as long as they do not have impermissible coverage. And so here's a big list of various types of other coverage that is considered impermissible, with the top being Medicare entitled. And so Medicare entitlement is kind of an important one. We hear the word entitled, we think, oh, I'm entitled to the benefit, I'm eligible for it. Well, in Medicare world, what entitlement means is someone is eligible for and enrolled in the coverage. So that's what's going to make someone potentially ineligible for an HSA. And we'll dive into this a little bit deeper on this next slide. Okay, so again, I kind of mentioned here, entitled equals enrolled. So it's important to remember for employees that, if an employee is enrolled in Medicare, they're not eligible for HSA contributions because they are now considered to be entitled to Medicare. Now, if we have an employee who is eligible for Medicare, so they're 65, but they have not yet enrolled, they retain their HSA eligibility. So they can still make HSA contributions until they have officially enrolled in Medicare. Okay, we're gonna kind of dive into this just a little more. So again, as I think many are aware, HSA eligibility is going to be dependent upon eligibility as of the first day of the month. And so the first month that someone is enrolled in Medicare, that's when they become ineligible for HSA contributions. So Medicare is always going to start on the first day of a month. One thing to note here, and this can be kind of tricky to people, is Part A coverage. So again, Part A is that inpatient hospital coverage, what we call the free part. Part A coverage can be retroactive up to 6 months if someone enrolls in Medicare after age 65. Okay, and so what that means is, let's say I want to continue working. I'm not going to enroll in Medicare until I retire at 67. When I go to enroll in Medicare upon my retirement, my Part A coverage is going to be retroactive 6 months. So if I want my coverage starting August 1st, well, my Part A is actually going to be 6 months retroactive back to February 1st, if I did my math correct. If I did it wrong, you guys know what I'm talking about. And so that's important for HSA contributions, because someone may have been making contributions to the HSA thinking, oh, I'm going to retire in August, and that's when, I'm going to stop making HSA contributions. But because I'm 67, my Part A is going to be retroactive back 6 months. So it's always important to kind of keep that tucked into the back of your mind if someone is delaying their Medicare enrollment and going to be using that special enrollment period. Again, so just like any other time someone loses HSA eligibility mid-year, annual contributions are going to be prorated based on the number of months that someone is eligible for the HSA. And then obviously, if there are excess contributions, someone's going to want to work with their tax advisor to withdraw those contributions to avoid potential excise taxes. So another question we get quite a lot is, what happens if the employee is not enrolled in Medicare, but the spouse is? So I cover myself and a spouse. My spouse turns 65 and wants to enroll in Medicare, but also still stay on our group health plan. What does that look like? Well, once the spouse is enrolled in Medicare, the spouse can no longer make contributions to the HSA, but the employee, because they're not yet enrolled in Medicare, they can still make HSA contributions. And as we know, HSA annual maximums are based on the tier in which someone's enrolled. So if that employee is still covering that employee plus spouse or the employee plus one, they can still make HSA contributions up to that family maximum, even though the spouse that they also cover under the group plan is enrolled in Medicare. And then obviously the HSA, the employee can still use the HSA to reimburse the spouse's qualified medical expenses, just like they could prior to Medicare enrollment. Now, the next one here, kind of, again, what does this prorating of contributions look like? So again, we have Benjamin. He is enrolled in employee-only coverage as of January 1st. He's an overachiever. And so by April, he'd contributed his entire annual maximum for the year. So he did the $38.50 for single coverage and then the $1,000 catch-up coverage. But he forgot that once he turns 65 and he's enrolling in Medicare as of August 1st, he can't make HSA contributions anymore. So he's actually contributed more than he should have for this year. So if he does nothing, he's going to end up owing income and excise taxes on that excess amount. Because again, because of his Medicare enrollment, he was only eligible for 7/12 of that HSA max. Now, just like other HSA mistakes, the excise tax can be avoided as long as that excess and any associated interest is withdrawn from the account and accounted for by the tax filing deadline. So obviously, if somebody finds themselves in that situation, they're going to want to work with their financial advisor or their tax person to kind of figure that out. But just knowing that, again, they may have to pull out some of that prorated HSA amount. Another practical example, again, with that spouse we talked about again. So James, he's employed by Pickleball Inc. So he covers himself and his spouse. He always contributes up to the family maximum, and then he does his $1,000 catch up, and his spouse, Anna, also contributes her own $1,000 catch up into her own separate HSA account. However, Anna is turning 65 and she's enrolling in Medicare as of August 1st of this year. But again, she's also staying on James's employer plan as well. So James, his status doesn't change. He still is eligible to contribute up to the family max because he's covering employee plus spouse. He can still make his $1,000 catch up just like before. But Anna is where we have a difference because, again, she enrolled in Medicare as of August 1st. So her catch up is going to be prorated. So again, she's eligible for 7/12 of the $1,000 catch up. So she's able to make a contribution of the $583 to her own HSA for that year in which she enrolled in Medicare. Okay, the next thing we're going to talk about here are qualifying events. And so just kind of a refresher, just on general Section 125 qualifying events. Again, if employees are contributing and paying those premiums on a pre-tax basis, the Section 125 rules are going to govern those elections. So they can't make a change without a qualifying event. And as we know, anytime there's going to be a potential qualifying event, the change someone wants to make has to be consistent with the event. Obviously, plans impose deadlines for when those requests can be made. And then if a plan is operating outside of plan rules, it can risk disqualification. So again, these are all just kind of the 125 plan and qualifying event basics here. So we'll talk about how does that apply to a Medicare enrollment situation. So again, we're looking at that consistency principle. So the action someone wants to take has to match the event that has occurred. So if, I cover myself and a spouse, my spouse is enrolling in Medicare, I can drop my spouse who enrolled in Medicare, but I can't drop somebody else on the plan. I can't drop my son because he's not affected by the Medicare enrollment. I can't add my daughter because I'm dropping my spouse. So those same consistency rules we always think about with qualifying events, they're going to apply here as well. And so again, kind of our practical application here too. And the thing we like to think about too is, when we're thinking about qualifying events, something like entitlement to Medicare is a permissible qualifying event. So it means that the law doesn't require that a plan allows it, but it is permissible. So you always want to check your Section 125 plan prior to allowing someone to make a change for Medicare entitlement. So our practical example here, Matt is employed again by Pickleball Inc. So he has employee and spouse coverage and he covers his wife. So Lucy is 65. She's enrolling in Medicare effective September 1st. Their plan terms say that it is a permissible event, but you have to notify within 30 days. Matt notifies his employer. So is Matt permitted to drop the coverage for Lucy? And I think our answer dropped off here, but hopefully everybody's thinking in their head, yes. Effective per the plan's terms, they are allowed to drop Lucy because she does have that Medicare entitlement and the plan allows for it. But is Matt allowed to drop himself? So the answer is no, he's not enrolling in Medicare. So it would not be meeting the consistency principle if he wanted to also try to drop himself. No, there's an answer. Okay. So then our next one here. And this is a pretty tricky topic. But hopefully we can kind of make it seem a little bit easier. So Medicare and COBRA. So the important thing to remember here with our little chart is, how COBRA works with Medicare is going to be dependent upon when the employee enrolls in Medicare. So if the employee was already enrolled in Medicare when they have their COBRA qualifying event, then they're still going to be offered COBRA. They're already enrolled in Medicare for some time prior to that termination of coverage or reduction in hours that led to COBRA. Now, if someone enrolls in Medicare after COBRA, so they retire early, they're covered under COBRA for a while, and then after that, they turn 65. You might be able to, or the plan might be able to terminate COBRA coverage. Now we have our asterisks there reminding us that obviously the plan has to allow this. The rule has to be applied consistently, and obviously it's only going to affect that person. So that person that was on COBRA and then enrolled in Medicare. But the timing is definitely important on that one. Okay, so another rule that kind of comes down to the timing of when someone enrolls in Medicare as it relates to their COBRA qualifying event. So when an employee has a COBRA qualifying event that occurs within 18 months after the employee enrolls in Medicare. Okay, so again, they enroll in Medicare first, and then later they have that reduction in hours that leads to a loss of coverage, or they terminate employment, and then obviously coverage terminates. In that case, the maximum coverage period extends to 36 months for a spouse or dependent who were covered under the plan. Now, the important thing to remember here is that 36 months starts from when the employee was enrolled in Medicare. So not from the COBRA date, so the date that, I terminated employment, but it's going to go back to when that employee actually enrolled in Medicare. Now, the qualifying events that are going to work here are, again, that termination of employment or the reduction of hours that led to a loss of coverage. Now, this doesn't affect the employee. The employee in question would have still just had the 18 months of COBRA coverage, but it does give a longer time period to that spouse or dependents. Now, again, going back to the timing rules, If the employee's qualifying event occurred before enrolling in Medicare, then you're just limited to that original 18 months. There is no extension up to 36 months. So kind of a practical application here, because I know it can be confusing. So again, Glenn works for the car wash. He covers himself and his spouse. So he enrolls in Medicare in September of last year. He and his spouse continued upon the group health plan during that time as well. And then at the end of May this year, he resigns. So the question becomes, are Glenn and Clara eligible for COBRA? And so I think, Yoko, if we click it one more time, I think our answer will somehow appear. There we go. Okay. So yes, both are eligible for COBRA because again, we had that termination of employment as of June 1st. Now Clara is going to get that special 36-month extension, but it's going to go back to September 1st of 2022 when Glenn first enrolled in Medicare. So she gets the balance of the 36 months from September 1st of 2022. Now, Glenn would only get the 18 months based on June 1st when he terminated employment. And so the last one here is, again, just thinking through, how does the COBRA coverage work with that Medicare special enrollment period we talked about? So again, someone has 8 months following the termination of that active employee coverage to enroll in Medicare to avoid that late enrollment penalty. That's that special enrollment period we talked about earlier. Again, COBRA is not going to delay the special enrollment period rules. It is not active coverage. So if somebody does want to potentially take COBRA, they need to be mindful of that to avoid that Part B late enrollment penalty. Now, if somebody was on Medicare and potentially had COBRA, if the prescription drug coverage covered under COBRA is creditable, then that person may be able to delay purchase of a Part D plan. But again, that's where they're going to work with their Medicare agent to determine what makes sense for their individual situation. And now I think Yoga is going to tell us a little bit more about the Part D creditable coverage notices.
Great, thank you, Kelly. And it's just a perfect season of the year that employers will be thinking about Medicare Part D credible and non-credible coverage disclosure notice to the employees, which is due October 14th annually. And just a step back, there are 2 requirements that employers need to keep in mind relating to the Medicare Part D disclosure and notice requirements. One of them is, as I mentioned, the Medicare Part D notice to eligible employees. Generally, employers are sending out the notice to all employees because they don't know the spouse, especially like Medicare eligibility status. So generally, employers should send out to all employees whether your drug coverage is credible or not. And it's due before October 15th. So that means by October 14th. We're going to go over that in more detail. And the other requirement, in addition to distributing a notice to eligible employees, basically employees, another requirement is to go into the CMS site to let them know on their internet portal, let the CMS know whether your drug coverage is credible or not. And then timing, the deadline is different. For the online CMS disclosure is due within 60 days following the start of the plan year. So for the calendar year plan, it's roughly around March 1st. Okay, so the first step to understand is whether your plan's prescription drug is credible, quote unquote. So what does that mean? In other words, does it pay on average as much as Medicare prescription drug coverage? And there are a few ways to determine whether your drug coverage is credible or not. And one way is CMS has this list of credible coverage simplified determination, or you can ask your actuarial determination. But I think from we have seen is that sometimes the carriers, especially if it's a fully insured plans, will able to let the plan sponsor employers know whether the plan is credible coverage or not. So think that it's best to work with the NFB accounting to figure out ahead of time so that you can reflect that credible or not credible status on your notice, which is upcoming in October. Okay, so the first one to go over is the Medicare Part D notice. So it applies to any group size, as long as you sponsor prescription drug coverage. And that notice needs to be sent out to Medicare eligible participants, including spouses, which generally employers do not have that information. So just to cover the bases, conservative approach or easier approach is employers send out the notice to all eligible participants. And that is due annually by October 14th. And if the plan changes the status in the middle of the year, then you have to resend the revised one to the newly eligible individuals. And just a quick reminder that this year, October 14th falls on Saturday. So you may want to keep in your mind, assuming that you don't work on weekends. So you may want to send out a couple of days before. And as you may already know, that CMS already has the model notice for credible or non-credible, and that can be distributed by hand delivery or mail or electronically. So as long as that electronic notification rules apply, then electronic way can be permissible. For example, like sending by email or posted on the internet and let them know where to find the Medicare Part B notice. That is permissible if they meet that safe harbor electronic distribution rules. And yeah, that's that. And then just a screenshot of the notice, how it looks like is on the top right. Hopefully it looks familiar to you. And then as of now, the model notice hasn't been changed from 2011. And the second one is a disclosure to CMS. As mentioned, the due date is depending on your plan year, ERISA plan year, but that's within 60 days from the beginning of the plan year. And then basically there's a website there and you go to the online and you complete about the plan information and let the CMS know annually whether your drug coverage is credible or non-credible. Okay, and then a couple of the FAQ that we often get from the employer clients or account teams, so that may be helpful. So we compile here. The first question is, can I combine more than one plan with the same credibility or non-credibility into one notice? So for example, you may be sponsoring like 2 or 3 plans, say one is PPO, the other one is Kaiser plan for the California employees. In that case, if they share a credibility, if both drug coverage are credible, can we just combine it on the notice or not? So the answer is, the short answer is no guidance. However, based on what our understanding is, likely employers can use a single Medicare Part D notice to inform participants about multiple prescription drug plans that share the credible or non-credible status. And then there's a section that you can spell out like specific plans within that notice that may be helpful. And just make sure that all employees who are eligible for respective plans receive that notice. And the second question that I just went over, I think many employers prefer sending the Medicare Part D notice electronically. It could be like sending by email or posting on internet, whether that's permissible. The answer is it depends on the employer, whether employer's business structure meets the safe harbor rules. So basically, if the employees have access to computer as a part of their job, if not, then they need to like proactively agree to receive those electronic distribution notice. And if you're thinking about posting the notice on the intranet, then make sure that you send out email a separate way to notify the employees where they can find it, and then the hard copy is available without charge. And then the other additional measure, we put it there. They may want to keep in your mind. And again, the deadline is October 14th every year. And then again, this year is Saturday, so you may want to be sure to send it before that, unless you want to work on Saturday. And the last one is, rather than distributing a notice by October 14th, can I include it in our annual enrollment guide or new hire packet? The answer is yes, but you need to be careful that if you're going to combine it with the open enrollment information or summary plan description, then it has to be in the prominent presented. So some suggestion will be to, and then it has to be in the 14 font and a 14-point font in a separate box and bolded. So some other, just instead of just plug it in, you may need to be careful about the formatting of that notice within that guide. Right. Okay, so the, I guess, good news is there's no penalty, specific penalties by not providing the Medicare Part D notice or doing the CMS online disclosure. However, as plan sponsor, you have a fiduciary duty. So we always recommend you to comply with the law. And then most importantly, employers need to know the credible status. And if their coverage is not credible, and if when they decide to delay enrollment for Part D, they may incur the penalty. So it's very important for employees who are Medicare eligible or a spouse who are Medicare eligible to be aware of this your coverage status. Okay, and then back to Kelly.
All right, thanks, Yoko. We're almost there, guys. We're making it through. So we're going to talk a little bit, very briefly, about Section 111 Medicare reporting. Thank you. So Section 111 reporting, it's been around since 2009. And so this is really dealing with those Medicare secondary payer rules that Yoko talked about earlier, and some data sharing requirements that, oh, can we go back? Thank you. Group health plans are going to have to provide information to Medicare related to the health insurance status of enrollees. And really this comes down to helping Medicare determine who is the primary or secondary payer, because obviously Medicare only wants to pay primary in situations where it truly should be paying primary. Now, for the reporting, we have the responsible reporting entity, or the RRE. So really the three bolded here at the top are kind of the key ones to look at. So for a fully insured plan, the insurer, the insurance carrier, is going to be the responsible reporting entity. For a self-insured plan, that's typically going to be the TPA. And then in the rare cases where we have a self-insured plan that also self-administers, then the plan administrator is going to be the responsible party there. But typically for most on this call, you know, if you're fully insured, the carrier's doing it. If you're self-insured, the TPA is handling this reporting. So generally not much that the employer actually has to do, but it's just helpful to know that this reporting requirement is out there, even if somebody else may be handling it for you if you have a plan that is subject to the reporting requirements. And then penalties here. Again, a penalty can be assessed potentially for civil penalties per day if individuals aren't reported, or potentially penalties for claims that were paid by Medicare but actually should have been paid by the plan. Again, more of just a thought here, since some other entities are handling that for you typically. And then we'll go next kind of to our final thoughts and some resources. Again, the big thing to remember here for employers is, don't assume whether someone is entitled to Medicare. Again, because someone may have a spouse that's older than them that's on Medicare. Someone may be on Medicare due to disability, even if they're not yet 65. So, we don't want employers making assumptions. Obviously, as we talked about earlier, employers really have to walk that fine line with educating employees on Medicare without incentivizing them or making it seem like they are trying to push them onto Medicare. Obviously, looking at those open enrollment processes to make sure that the correct information is going out to employees within the deadlines. And obviously, if you find mistakes, we want to make sure that they are being fixed as soon as possible. And then our final one here, again, resources. So we do have a really nice toolkit and publication that employers can request from your consultants. Specifically, we just updated it this week for Medicare Part D disclosures. So information about both the notices that go to employees and then the disclosure that gets made to CMS later in the year. Obviously, if there are updates in the Medicare space, definitely make sure that you are checking out our compliance corner because we occasionally put things in there, such as a recent FAQ, again, about that change I mentioned earlier with when Medicare starts for someone enrolling in the general enrollment period. So definitely keep a lookout there. But otherwise, yeah, thank you all for hanging in and sticking with us in this hour. I saw we had a ton of questions come in, and hopefully our team got some good answers in. I did see one a couple of times that I wanted to talk through because we didn't necessarily mention it, but just the reminder with Medicare, again, each individual is making their own elections. So I can make my elections, my spouse can make different elections. When we're looking at Medicare premiums, so those Medicare Part B, Part D, or supplement premiums, those are per person. So if I'm enrolled in Medicare and so is my spouse, we each pay a Part B premium. We each pay a Part D premium. We each pay a supplement. And that also means if you're someone who is one of those high income earners, and we talked about those surcharges, each person would also pay that surcharge, because if I'm someone who is married filing jointly, that surcharge amount is going to be based on our joint income tax return, assuming that's how we file. So definitely just remembering that it's not a family coverage or a family premium like people might be used to with employer insurance. It's really on that individual level with each person having their own premiums. But with that, I know we are just about up to 4 o'clock for those of us on Eastern time. So I will thank Yoko for joining me on this very important topic, and then hand it over to Amber.
Actually, Kelly, let me butt in here. Sorry, Beth Allen here, everyone. We did monitor the questions. Thank you so much for everybody participating today. We got a few questions about whether or not we would make the FAQ available, or whether or not these slides were appropriate to send to, let's say, employees. And I really want to underscore the point here that Medicare, although we wanted to present on it and understand that employers have questions about it, is very individual in nature, right? And so we are likely not going to recommend that these kind of slides be given to employees, especially if employees are not in a place where they understand exactly what it is that we are saying, right? Instead, we would say, point them to CMS guidance like the Medicare and You publication that I put in the chat today, or to a Medicare agent or professional, as Kelly mentioned. Okay, so keep in mind that we will share some things along with the slides and the presentation on Friday, but we will decide as a team whether or not the FAQ is appropriate as well. So just that note, go ahead, Amber.
Awesome, thank you. Thank you, Kelly and Yoko, for sharing your valuable time and expertise with us today. To reiterate, today's presentation was recorded. We will be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you will receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At the end of this call, a survey will populate in a new window. Please take a brief moment to complete the survey, as it lets us know what topics are important to our listeners and helps make our education program as current and relevant as possible. That concludes our webinar for today. Thank you, everyone, for joining us, and have a great day.